Hi, this is Andrea Kane, and I'm here with you again for HSC 114 Medical Terminology, where, where we are learning the language of medicine, 12th edition by Davie Ellen Chabner. We are now on Chapter 4. This is the second lecture video for week 2, and we're going to be talking about prefixes. Last chapter we talked about suffixes, and we're going to cover a few more here, but we're also going to focus on some prefixes. Our chapter goals are to define the ones that are used in the medical language and how that works together with combining. We're also going to learn about the RH condition as an example of an antigen-antibody reaction. So let's get started. Combining forms, we have carpo, ciso, costo, cutaneo, dactylo, ducto, flexo, glosso. Glyco, immuno, morpho, morto, nati. Ooh, let's stop here. We have an I. Did you notice that? They snuck that in on us. Normo, oxo, pubo, sepso. Have you ever heard of a sepsis infection? It's like saying infection, because sepso means infection. So when somebody says, oh, that person has a sepsis infection, they're essentially saying infection. Silly, I know, but there you have it. Somno, sono, theo, theolo, and thelio. Notice those two, they sneak an I in there on the second one. They both mean nipple. Tenso, thyro, topo, toxo, tracheo, urethro. A few suffixes for us now. Crin, drome, fusion, gia, lapse, lysis, meter, mission, or oxia. Partum, phoria, physis, plasia, plasm, nia. Remember how we talked about ptosis? Well, here you have nia, and that P sometimes slips in and out. An example, apnea. If you're going to say apnea, that means no breathing. Someone has a condition of no breathing, apnea. Dyspnea or dyspnea, see that P? It kind of disappears with apnea. We definitely pronounced it with dyspnea. It kind of disappears. Dyspnea means difficulty breathing. You have tom, symptom, as an example. Ptosis, we just talked about. Rhea, stasis, trophy. And now some prefixes. A or an means no, not without. Remember how I said apnea meant without breathing, not breathing? Ab is away from. Ad is toward. And you need to know the difference between these two. One quick way to remember this is the B faces away from the A. The D faces toward the A. So notice that, okay? The B, this part of the B here, it faces away from the A, whereas the D faces toward it. And that may help you remember it. Anna, anta, and I talked a little bit about this at one point, I think, anta. Anti, notice the difference. Anta, there's an E there, it means before. Anti is against. So you want to make sure you pronounce those very carefully and you spell them very carefully because they mean two totally different things, yet they're one letter apart. Auto is self, by, Brady, kata, con. Contra. Notice here you've got con meaning with and together. Contra is against or opposite, so watch out for that too. Dia, they sound somewhat similar, but they mean different things. I mentioned dyspnea as difficult breathing. Endo, epi, U and X, hemi. Now I want to pause here on hyper and hypo. Medication errors and other care treatment errors have been made when people have misunderstood or miscommunicated when it comes to hyper and hypo. If you have hyperglycemia, your blood sugar is too high. If you have hypoglycemia, your blood sugar is too low. If you give the treatment for hyperglycemia to someone with hypoglycemia, it could be a life-ending mistake for the patient. So it's very serious. You need to make sure that how you speak it and how you spell it is correct. In can mean not into or within. Infra, inter, intra. Notice that these three are spelled very similarly. They have somewhat different meanings. So again, watch out for those. Macro, mal, meta, micro, neo, pan, para. Per, peri, poly, post, pre, pro. Pros. Watch that. Pro and pros mean the same thing. One has an S, one doesn't. Retro, sub, supra, sin, and sim. Ooh, we've got two spelled very, very closely the same that mean the same. So just watch out for that. Tachy, trans, ultra, and uni. Tachy and cardi are opposites, and maybe it'll help you to memorize them that way. Brady. Tachy and Brady. Tachy is fast, Brady is slow. Quick quiz, which term means toward? A muscle that draws a limb toward the body. Toward. Which term means a muscle that draws a limb toward the body? And it looks like this is a bit of a, oh, they want you to know whether it's ER or OR. Sneaky, sneaky, sneaky. You might want to go back and take a look at that. Let's see if they talk about that. Yes, top of page 106. I'll give you a hint. Take a look at the top of page 106. All right. Quick quiz. Which term means painful breathing? I gave this to you already. Sorry. Painful breathing. I used that term a couple of times. All right, closer look, antigens and antibodies, the Rh condition. When you talk about blood, do you ever notice that people talk about A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, O negative? Those are the types of blood, but they talk about positives and negatives. Well, we're going to talk about what that means, why you don't just say I have A blood or AB blood or O blood. Well, why the positives and negatives? This is pages 114 and 115 in your book. It has to do with an immune response. An antigen is a substance, usually foreign to the body, that stimulates the production of antibodies. The antibodies are these protein substances that are made by white blood cells in response to the presence of foreign antigens. Essentially, an antigen is perceived as an invader, that they have come to invade the body. And the body says, not so fast. We detect something here that is not supposed to be here, that seems to be foreign to us. So we go out to the white blood cells and say, ooh, we need something to fight off these invaders, also known as antigens. So the white blood cells create these antibodies and send them to the site where the antigens are to react, to fight off the antigens. So the antibodies are fighting the antigens and making them go away, because this antigen shouldn't be here, according to the body. And that's really what this is all about. This is exactly what happens. So you can read through your book because it's got a really good explanation of this. But the bottom line is, let's say you have an Rh negative mom. Um, that happened to me. I happen to have A negative blood, and so the first baby that I had was fine. But after that baby was born, um, my body made these antibodies against a positive baby. In my case, I got a ROGAM shot, and I had to do that after each pregnancy. And the reason for that is the ROGAM shot then went in and basically told these antibodies back off anytime she's pregnant, that this antigen, which is the baby, because its blood is positive, is okay. And so that's where you have that. So I'm not going to go into a whole lot of detail because I don't think you get tested on this, to be quite honest. It's just something that you would know. Um, it's not the first pregnancy that causes the problem, it's the second one. Um, and the ROGAM is given whether you're talking a miscarriage, abortion, or birth, to try and again make sure that the antibodies back off and the baby is protected. The subsequent pregnancy baby is protected. So Rh condition, an antigen antibody condition that develops when there's a difference in the Rh blood factor between that of the pregnant mom and that of the baby. And this is all in your book. So antibodies, they are made by what type of cell? We did cover this. Which term means white? All right, on to congenital anomalies. And this is on page 116. A congenital anomaly is an irregularity in a structure or organ that an infant is born with. So notice this. In order to be considered congenital, it's something that someone is born with. And it can be very minor. Some examples that they're going to cover here are both major and minor, because I would definitely consider a heart defect major. That's probably going to require surgery to handle. Clubbed foot, or you might have heard of, let's see, what are some other ones that you might have heard of? Spinal bifida might be one. Syndactyly, where someone's fingers or toes grow together and don't separate when they're growing inside the mom's uterus. Those are different kinds of things. And they also give you an example of something that may not be necessarily sort of what happens through, it can happen through the environment, let's say, because it points out that some are hereditary. In fact, some heart defects may be hereditary. Some things they have found do come down through defective genes that people are carrying, and you get two carriers, and then you suddenly end up with a congenital situation. Others happen because of what happens during the pregnancy. And one of the examples that they have found is that when a pregnant woman drinks excessively, not successfully, but excessively, it can result in physical and mental defects in the infant at birth. The same thing with using illegal drugs. They have found that some women who utilize drugs during their pregnancy, illegal street drugs, they result in physical and mental defects beyond the withdrawal symptoms that happen. Excuse me. So moving on, recombinant DNA. Now there's been a lot of talk about recombinant DNA. when you talk about insulin and how it's manufactured, and this is just information here for you, FYI. I'm not going to touch on it because I don't use it in the quiz. And it's something that if you go further into anatomy, physiology, um, and some of the other fields, for those of you who are going into nursing or to become a physician, to medical school, that you'll find you'll get into more detail there. So I'm not going to cover too much. Syndromes, this starts on page 117, talks about different syndromes. It's a group of signs or symptoms that commonly occur together and indicate a particular disease or abnormal condition. The one that they give you there is Rye syndrome. This was really well known in the 1970s and 80s because of children who took aspirin. And I think it was mostly 1970s. They took aspirin and it resulted in liver dysfunction. And so for a number of years, it was really, there were major public health education campaigns to tell parents, if you have a child and you suspect they may have something viral or bacterial, don't treat them with aspirin. Use acetaminophen or ibuprofen. And that's an example. And then they give you a couple of others, but there's a lot of syndromes out there. TURP, transurethral resection of the prostate gland. This is something that affects males because they are the ones with a prostate gland. This procedure is where they go in through the urethra, see the transurethral, and they resect. They remove a portion of the prostate gland. This procedure is typically done when the prostate expands. It may be inflammation related, it may be cancer related. There's a wide variety of why a man's prostate might experience hyperplasia, that abnormally excessive growth, and it interferes with urination. And let's see, do they give us? No, they don't give us a visual for that. Well, they do in your book, top of page 118. If you look in your book, figure 4-13 shows the TURP procedure. But what I want to point out to you is if you look at the prostate gland, it is squeezing that urethra, making it very difficult for the urine to flow from the urinary bladder out through the penis. And so what they're trying to do is they go in and they resect, remove a portion of that prostate gland to free up the urethra so that the urine can freely move from the bladder and out of the body. So that's what that is for. And I think we talk about that procedure once more through the class, but that's what that is. There are also procedures now where they go in and they use lasers to what's called fulgurate the tissue as well. Ultrasounds, ultrasonography. This is a diagnostic technique used by radiology departments across the world. They take ultrasound waves and run them across a section of the body, a particular organ or tissue area, and it produces an image. We're most familiar with hearing about ultrasounds with babies, preborn babies, looking at how their growth and development is in the uterus. So, but it is used for other things. They give you the example of an echocardiogram. That's of the heart, where they can go and they run the ultrasound waves across the heart to see how the heart is functioning and whether or not it is larger than it should be, which is cardiomegaly. Sonogram, that's the fetal ultrasound image, but anything can be ultrasounded, so to speak. You can have it of any abdominal organ. Um, it can be done. It can be done of a variety of things. That is it for chapter 4. This is the end of week 2. I hope you have a great rest of the week. I will be back to talk to you about week 3, where we move into our first body system, which will be the digestive system. There are 2 chapters with that, but they pretty much they go together, and so it'll be fairly quickly to get through that. Have a great week. Talk to you again soon.